Hey, thanks for tuning in. Today we're going to be talking about tonsil surgery. So first off, what are tonsils? They're the little pieces of tissue that live at the back of your throat on either side of the uvula. That's the little hangy downy thing in the middle of your throat back there. Ideally, they're kind of relatively small and stay out of the way, but sometimes our tonsils cause trouble, and that's when we think about removing them. Two main indications are recurrent infections and obstruction. So in terms of infections, we want to see 7 infections a year for 7 infections in 1 year, 5 infections a year for 2 or more years in a row, and 3 infections a year for 3 or more years in a row. These infections are going to be bad sore throat, active inflammation and exudate on the tonsils back there, maybe swollen lymph nodes, maybe fevers and chills. Generally speaking, your doctor's going to give you antibiotics to treat these sort of infections. Strep test may or may not be positive depending on what's going on back there. In terms of the obstructive symptoms, we're looking for children or adults that are not sleeping well. They're snoring very loudly, and when you listen in on them, you're going to hear snoring, but then stops in the snoring, pauses in their breathing, where they're not breathing at all, and maybe gasps as they start breathing again. If it's significant enough to warrant surgery, you're probably going to be thinking, man, that makes me nervous hearing my loved one sleep that way. If it's that bad, they may very well be a candidate for having their tonsils out. So what's involved with surgery? Well, it's done under general anesthetic, and so we have to do that at the hospital. Now, with any operation, there's always risks, benefits, and alternatives. So the alternative to surgery, of course, is to keep doing what you're doing. Generally speaking, that's not working very well, because that's why you came into our office to talk about this. But removing the tonsils doesn't save lives. The goal of taking out the tonsils usually is to just help stop those recurrent infections or to help you sleep better and rest better. Risks to surgery include risks of anesthesia. There's a small risk of bleeding and theoretically a risk of infection during the surgery itself. Those risks are thankfully very small. One risk, it's not really a risk but more of a consequence, as you probably know, is a bad sore throat. You're going to have a bad sore throat for about a week or 10 days. One exception to that is on my younger children. Sometimes I offer an intracapsular tonsillectomy. Those children recover much quicker and much easier. We'll talk more about that in a separate video. If you've had your tonsils out the old-fashioned way, you're going to have a bad sore throat for about a week. You're going to have Tylenol, you're going to have some ibuprofen, you might have some prescription pain medicine as well, and probably something for nausea just in case. You can eat anything that doesn't crunch when you bite into it. Particularly we want to avoid crackers, chips, popcorn, anything, again, that crunches when you bite it. I don't care how much, however, if you don't feel like eating, that's okay. It's very important that you drink. If you get dehydrated after surgery, things are not going to go well. The healing slows down and everything gets more miserable. So keep taking your pain medicine as necessary and just focus on drinking. Make sure you're peeing on a regular basis and that pee stays in the clear to light yellow color. For the first few days, I usually recommend taking something at least every 4 to 6 hours, even if it's only Tylenol and Motrin, almost whether or not you think you need it. It's much easier to stay ahead of that sore throat than let it get really bad and have to play catch up. One other small risk, one other risk that's associated with surgery that's very important to discuss, although it's not expected, is a risk of bleeding after surgery. You get little scabs on the back of the throat where the tonsils were, and when that scab falls off, it can cause some bleeding. Picture a scab on your knee, you pick it off too early, it might ooze a little bit. Sometimes the bleeding in the back of the throat, as you would imagine, doesn't sound so good. So if you see more than a teaspoon of blood or any bleeding lasts more than 5 minutes, I always want to know about it. Even at 2 a.m. on a Thursday, you can give us a call and we'll figure out what to do. Now, roughly 96% of patients do not have significant bleeding after surgery, so we don't expect that, but every once in a while it does require intervention, so we want to know about it when it occurs. That's the majority of the generic information about tonsillectomy. Please don't hesitate to ask if you have any more questions. Please let me know down below. Thanks. Thanks for watching this video. As always, this is meant to be general educational material and is not meant as specific medical advice for you or your family. If you have any concerns, please reach out to your doctor for appropriate medical advice. If you have any questions, please leave them down below and I'll answer them if at all possible. And if you're interested in making an appointment, please look down below for more information on how to do so. Thanks for watching.